Good afternoon.
That's all.
Thank you for joining us today for the December meeting of the Pitt County Department of Social Services. Appreciate our viewing audience being here, as well as the management team and the Board of Trustees today for the Social Service Division. Let's begin our meeting call to order with a moment of silent prayer or silent meditation, please. Thank you. You have at your place today a copy of the agenda. Can I have a motion to accept this agenda, please?
Motion to accept the agenda.
Second. All in favor?
Aye.
Thank you. You also have the minutes from our previous meeting. May I have a motion, please, to accept these?
We approve the minutes.
And second?
Second.
All in favor?
Aye.
Okay, moving along, we have an update from Mr. Perry, the Director, for the status of our agency personnel.
At the present time, we have 19 positions vacant. There will be vacant within the Pitt County Department of Social Services. We have 5 positions in the administrative unit. In February, we will lose our personnel technician, and Miss Angela Hart will be filling in that position if we do not get it filled. So Angela will be doing 3 additional responsibilities, acting the Sheriff Farmer's position, as well as being the one that will handle all the human resource function, which would be classifying people that are eligible for different positions and doing that. So hopefully that position will be unfrozen, but if not, then she will be able to take on those responsibilities. And then we will have to look at shifting some of her responsibilities.
I was getting ready to say she must be Wonder Woman.
Well, she's working on it. She has not arrived yet, but she's getting there. And then we have 9 positions vacant within the income maintenance unit, and we have 5 positions vacant within the services unit for 19 positions. We have 16 positions that are frozen, 2 that we're interviewing for, and 1 that we're waiting on a background check. And we have filled 4 positions since the last time. Belinda H. Bueller was employed December the 5th. Joyce H. Bunch employed December the 5th, and she will be working in the position at Pitt Memorial Hospital. And Summer Sinclair later transferred, and Dakita Barnes were promoted to an income maintenance caseworker 3 effective Sunday. So those are where we stand at the present time.
I'd like to welcome those new positions and those been promoted. Thank you so much for your help. I guess we ought to pause for just a moment talking about the personnel and recognize that a lot of frozen positions, increasing demand, as we've talked about at the last meeting, and just make sure we're comfortable with how we can be effective meeting the requirements that we have from a federal and state level, and understanding the impact these frozen positions have and what the future possibilities are here with relative to our workforce.
Yes, Melody. All right, Social Service has by far the most that resign or retire because of so large department, of course. Is there any way they're going to be hurt much more than, say, a department does not have any? They're losing, and therefore those positions are not frozen. Is there anything in the works pertaining to protect that?
Right now, Mr. James, we have over 50 positions countywide that are frozen.
How many of those are in the social services?
19 of them.
19 of them. What percentage countywide? That's what I'm looking at.
We have roughly 900 employees, so we have about 5% of our positions vacant right now.
And out of that, though, the majority of them, by far.
19 of them are in social services, which is
19 of 50.
38%.
19 or 50.
Yeah, that's
look at how many employees. I mean, 1 vacancy in my shop is 10% of my staff. 19 vacancies in DSS's shop is about 12 to 14% of theirs. So it sounds like a lot, and it is a lot given the volumes that they're dealing with. But right now, until we can get a handle on revenues and ensure that we're not spending away our savings, you know, your fund
Well, I
balance.
understand
That's
that,
why the
yeah.
vacancies are there. And they're, about the only exemption to the freeze is a 911 telecommunicator, because we don't have any excess coverage down there, and probably a deputy. Those two types of positions are pretty rapidly re-advertised.
Okay, that's all I have, Mr. Chairman.
I guess one of the things that I was thinking about is that Mr. Perry had talked about a series of contingency plans and that he had in operation. How are those working with these additional vacancies?
We are able to get the work out at the present time, but it's only because we have additional staff that are willing to take on those additional responsibilities. Now, what will eventually happen is that services will start getting slower, because there's no way that we can continue to meet those mandates of 30 days for processing a food stamp application, 7 days for expedites, and making sure that we continue to meet the Alexander versus Flaherty requirements of processing cases within 90 days. So at some point in time, we will begin to start filling report cards, because as the cases continue and the workloads continue, the same amount of staff will not be able to continue to meet those mandates. So occasionally we will fill a report card. We failed it in, I think, October or November. But hopefully we will not fail in 3 consecutive months, because if we do, then that will require the state to come in, look at what we're doing, and give us direction. We know what the problem is. If you don't have staff, there's no way you can continue to meet those mandates.
And I think that's important, because that's really having an effect on the citizens with this type of economy. And it sounds like a lot of the employees are very dedicated, and they're taking on a lot of extra work, and I think it speaks a lot to your leadership to get them to maybe go above and beyond. But as you're saying, at some point, that's not going to work as well.
And what we, to the credit of the county, we have a lot of staff that has put 20 and 30 years in, and that they will be retiring. So we're looking at next year, maybe 3 or 4 additional staff retiring, so that those positions will then roll right in to frozen positions. So it's not that a lot of people are leaving the county because they're dissatisfied, but once they reach that retirement age, they're leaving. Those positions are not filled, and that's where our crises are starting to come in with those frozen positions.
Well, I certainly want to thank you on behalf of the county commissioners, because we know it's not going to get any better. We know that for the next couple of years it's going to be very, very bad, because we got, well, reevaluation 212, and it does not look good. It's pretty bad. I'm looking for probably the next 2 or 3 years to stay that way.
Also,
so we're going to have to look
yeah.
for those ways that you're talking about. They're going to have to step up to the plate. They're taking to try to fill in.
Yeah. And as we get to the director's report, I'll talk a little bit about our Food and Nutrition Services participation report, where you can see how 2005, where we were with our number of people receiving and where we are today. So we can see that the economy is having an impact on the number of people coming in receiving our services.
I want to know one thing about the personnel. When they take on extra work and take on extra duty and extra task, do you have an incentive program?
No, we do not.
They don't have the money. That's the reason
Well,
they're being replaced, is because we don't have the
like
money.
Eugene James and a private fund, you know, or something like
We
that.
have no additional funds.
Very
We,
well.
they take on additional responsibility, because one thing we have in our job description, other duties as assigned. So we have that catch-all phrase. And if you're in that position, getting additional work.
I guess one of the questions that I have, at least, is we look at the frozen positions, and they start to become, you know, we're looking at social workers, for instance. You have 5 social worker positions here that are frozen. These income maintenance caseworkers. they're attached to service provision specifically. They're not clerical staff, or they're not in jobs that can just be easily replicated by someone else. At some point, there's a critical mass of people just necessary based on benchmarks you've given us. We've been spending the last couple of years building in place and creating benchmarks so that we could get to a point of evaluating how much can we cut and then be safe in terms of delivering services. But I can't tell with this, it starts to look like it's accumulating in certain areas or categories of jobs that do impact our ability to
That's what I'm concerned about.
actually deliver services. And so I'm sure we know what the critical mass is necessary.
Right.
And so are we, to me, it's not an option for us to fail the report cards. So subsequently, what is it that we can do to help mitigate that? And at what critical level do we reach where it's obvious that we've now reached the threshold where freezing a position means we simply cannot deliver based on benchmarks, based on more than just what we've been able to do in the past?
Based on that, I think one of our questions at an earlier meeting was, when we look at these positions, we see them as a group before us, but is there a prioritization needed on their critical, those that are approaching? Because nothing here says, right here, every position is as critical as every other one from what we see. But in view, in the shadow of what Brian has just asked, do we possibly need a column out here that states these positions by priority? And obviously those that are direct patient service. Now, having said that administrative positions can be replicated, let me tell you, historically that may not be so accurate because it takes experience to be there. I understand that. But when we approach these critical masses, as Brian has described, wouldn't we as the board need a prioritization over here of the areas when we see them, maybe not by names like down here, but by that position? Because it is conceivable one department could be very nearing critical mass. Well, we can't wave the flag to the state and everybody that got to have them all. So why wouldn't we have a column over here that says?
I can do that. What we will look at when you come to Child Protective Services, investigation, assessment, and treatment, we will prioritize those as being critical positions because those are the positions that go out into the community, do investigation of abuse, neglect, and protection of our vulnerable children. So those are high critical positions because we do not want, because we did not go out in the time frame that a child is died as a result of us failing to do something. So those will be our critical position, will be our CPS, and then we will fall in line with our income maintenance positions. But we got to have staff that can go out when a call come in to do an investigation to make sure that that child is safe, and if we need to do a plan, that we can do a plan for that, safety plan for that child.
On the caseworker to food and nutrition, the four, I know there's 4 of them there. All right, is that department, how many, that's really what I'm concerned with. If too many get out of a department, then you could be in trouble unless somebody steps up like you're talking about to be able to take and fill in. But how many do you have in that food and nutrition?
We have 21 positions in food
you
and nutrition.
lost 5 of them, so that would be a large percentage of them. That's what I think we have to be concerned with. And maybe some of them you're not losing any in those departments. I mean, in that section, not your department, but in that section. But I think that's what we're going to need to know, and how those particular ones.
I will bring the numbers, how many caseworkers we got, how many positions that we got filled, what is the average caseload that those workers are carrying, and a comparison with counties similar with caseload, so we can look at where we stand.
Okay.
And I just think
And I
that-
think what I was asking, Mr. Perry, was maybe one level. I understand those mandated programs and the children being a general priority to start with. But when it comes to us and it's all in there, just like Mr. James said, one department might have 4, but if it was a 30 department, that might not be as critical as a department that had 10 and had lost 3 or 4.
Yeah.
So I think that priority, if you could bring that level to us, those that would first affect. And your other data is very good to have. One cover sheet of that would certainly last for some months because we could sit there and have it in each fold and compare it. But those areas that are reaching more nearly Mr. Floyd's term of critical mass, I think that's what we need at the board level.
Okay, we will get that.
Thank
To
you,
me,
sir.
I think one other, because what we want to do is be able to advocate appropriately to help make sure the services, kind of concerns me when you say, we will fail at some point in the future at the rate that we're going. So, given that, maybe your assessment over programs, and you've listed out the ones that require that kind of thing. But when as the director, you say this one's reaching a critical mass where I don't think that we can, if we lose one more person, or even if we stay where we are, whatever the case may be, we cannot meet the requirements of this. Your assessment of that, and then my question then back, and maybe this is a question for Melanie, is so what? So we get that information, and what we have is the team saying we've reached a critical point now, we cannot deliver the services. What is the course of action that we would take next?
I think the bigger thing is to convince Mr. James in his other role, along with 8 county commissioners, that maybe you don't always solve your problems by cutting costs. In some instances, there are costs that have to be paid. And I know we try to cut our way down to our tax rate, and sometimes there just aren't places to cut anymore. We are shifting positions. We are identifying departments that have capacity and moving them across, in some instances, all the way across the county to fill in a department where there is a vacancy. We are doing our best to try and get into budget in a posture where we're not spending fund balance, we're not negatively impacting the county's overall fiscal posture, till we can decide where can we afford to reduce services so that we can afford to then increase services in another area. Do I have a department that we can shrink that's a non-essential service that may need to become you get it on the 4th day instead of the 1st day in order to switch the resources over here to a DSS where I can't process anything within 30 days anymore because I have too many cases. We've already started meeting with all of the departments. We've had our first round of discussions. We are asking everybody to think hard about what is the appropriate size, not to provide necessarily this top shelf level of service, but to provide that service which you are required to provide, so that these mandated services can be provided as best as possible, and some of these more discretionary services may come down a notch. Right now, without knowing the impact of revaluation, we don't have any big one-time, big ticket items we can pull out of the budget to free up capacity. I mean, there is no capital in the county's budget. There are no replacement vehicles in the county's budget. There are no chillers or roof repairs. That we're down to just the nuts and bolts of operating county services. And I see this budget that we're getting ready to go into as probably the hardest we've ever done, in spite of it being you're coming out of the recession, because the demands for our services have gone up so high in the recession. I think we're probably 2 to 3 years behind the rest of the country.
Melody, I think you hit it on the head. Shifting positions, shifting personnel. And not only do we look at the department, but we've got to look at it in social services. All right, there are some here that's not being retired in those sections. Then Mr. Perry is going to have to look at those and say, look, can I shift one of these people from this position over here to a caseworker or somewhere else? Do you follow what I'm talking about, Mr. Perry?
Yes.
Okay.
You
I
have
think we're going to have to look at that, and that's the question that the county commissioners are going to be asking. Not only do we need to shift somebody from planning, say, but at the same time, in social services, can we shift those personnel to another position where they are more needed?
And it may be, I
Cross-training.
think it would be premature for us to get into that as much as it would right now. What's critical? I'm not sure we know yet. We
No, we
see
don't. That's
we
what
see
Mr.
a lot
Perry
of
Mr.
a lot of risk, but I don't know that we know at what point
Yeah.
it becomes that you all have to make a decision
No, I
about
hope we don't.
reallocation
I
of
hope
resources.
that, I hope we don't. I hope.
But it does seem disproportionate, the amount of liability in terms of FTEs that may be in social services at this point. The disproportionate risk seems to be here.
And you do by far have a cluster. I do know that when they meet weekly on the vacancies, George is allowed to determine where his critical need is. We're not saying, well, we'll fund the cheapest position on the list.
Right.
We say, George, you can have 2 slots. You pick out which 2 are your highest priority. So we are letting the department try to address the needs. It's just unfortunate that, you have 9 caseworker vacancies in the income maintenance section. But, I was asking PJ, can a adult Medicaid who may have an extra hour today pitch in food and nutrition? And sometimes there's some functions that can be potentially done maybe on the front end, taking the interview, doing the interview, taking the application, but on the back end, the rules of the program are different enough that I'm not sure you want the Medicaid brain making the decision on the food and nutrition when their rules aren't the same, or we gain liability because we did it wrong.
And not for open, discussion here that could, or belabor the point, but the turnover rate. I think I heard you say you weren't concerned about, but it looks like seven are resignations. So
But
maybe another
7 are
thing.
retirements as well,
I agree, but
which is incredible. That somebody this day and age has stayed. Those are 30+ year
Yeah.
retirements.
Do you cross train or have any of that merging of the lines in your positions?
No, we don't cross-train. Basically, all the different food and nutrition service, family and children Medicaid, adult Medicaid, each of these programs had different income limit, different reserve limits. So workers are trained to do applications in that program, to do reviews in that program, to do changes in that program, because the rules change and they are focusing on knowing how to do one program and to do it well. So that's why we don't have generic caseloads, because if you did the applications, you wouldn't be able to do the reviews or to do the changes. So if someone is out, then we have someone that can take over that whole caseload, as opposed to just being able to function in just one part of a program. Now, when they come up with NC FAS, hopefully in 2012, that process will hopefully free up some time, because the application will be done by the computer, so hopefully that would free up some time. But that's
But we still said even that program, if I remember
Right.
correctly, would only save us a
about
few
2.2 hours,
a few
so-
hours, so it wasn't going to be a windfall by any chance. Dr. Hamilton
Yeah.
and Mr. Mayo.
One of the things that I was interested in is that you were talking about how Mr. James could advocate for us to the commission. I see you woke up at that point. I'm wondering, would the report that you're talking about and the information that you're looking at in terms of prioritizing and things, would that be something reasonable that might help the county commissioners make a decision more in line in terms of what we'd like?
We take that data forward. I mean, when George talks caseloads, comparable counties, turnover rates, all of that we build into the budget so that they understand the impact of these 19 positions.
What I was thinking was something more concrete, because I think that would be good in terms of, I don't know, just kind of thinking maybe a short presentation where he has a 1-page or 2-page thing that he can show the county commissioners the information that we're talking about, so they don't have to look for it in a giant report, if that would be helpful.
I agree, and I think that as the degree to which that can be narrowly focused on here are programs we have to provide service to, and there is, for the most part, most things you can calculate a certain degree of risk. You can say it generally takes 5 people to do this really well. For 4.5 people, we can do this on an average level, but once we get to 3, we just simply can't meet these numbers anymore. That creates a floor from which commissioners and others can simply understand and not have to interpret, but just in our best view, these are absolutely essential, not just budgeted, but essential to delivering the services.
But, Mr. Chairman, the thing about it is this: we have, and Melvin knows this more than I do, we have a certain amount of money that we can spend. And when we spend that money, we don't have any more money unless we raise taxes. And the sentiment of that board right now is that they're not going to raise taxes. And the people, the department heads and so forth, are going to have to learn to live within what we have. That's the philosophy, and it probably won't change.
No, but that's unfortunate that we're asked to live within what we have when we have no control over the number of people coming in to receive.
Oh, yes.
You know, I can't say that we have
I know
maxed
that.
out on our caseload, so therefore no one else comes in to be seen. You know, we.
And that's the hard part about it, is the decisions have to be made at some point as to what do we, within what means is what department living in, because
But that's where we got to cover that swap.
this is the one department that does absorb the brunt, or not the one, but this is one of those areas where we absorb the impact of the very economic conditions you're most concerned about, put pressure back on this place, and for this, you know, for the community's well-being, we have to be cautious not to freeze and slow down and create a future backlog here that means we simply cannot provide necessary services to the community as well as those that are federally mandated, or that shut off money because of the fact we can't distribute it. We can't distribute it
And
to
that,
services.
in a sense, seems like where we're going, kind of, if I use Mr. Perry's information, that at some point we're going to drop below that, and even though we're living within our means, we can't meet our mandates. And when things get worse for the rest of the world, for a lot of the people we serve, it gets doubly worse. And so our client requirements go way up. So at some point, we're going to have to look at those issues, that when we live within our means, that means that we're going to not make a lot of the things that are required of our services.
Just in the interest of time, I think we had a request to be able to, at the next meeting, review the risk profile as you see it. And maybe that would help us know what the next conversation really ought to be. Mr. Mayo.
About a year ago, when we did this budget, I asked for, what if that was a 5% cut or a 10% cut? I'm not sure, maybe I was the only one, but I didn't receive that. And that is really this same question about prioritization. That's exactly. So we are now, 1 year later, we're right back around the circle and parked at the same spot. And I think that we more or less have to have that, and it has to be that information, really critical prioritizations, and it should be the same thing this board receives that county commissioners receive or the county manager receives.
So we have a homework assignment. Agree with you, Mr. Mayor, and we will review that at the next meeting. Okay. All right. We also have a couple of matters that do require board action. So we have a couple of budget amendments that Ms. Flynn will make.
Yes, sir.
$361, which was rolling forward some donation money that we got last year into this year, so we could go ahead and spend it. And then we also received a $2,000 donation from Greenville Utilities for helping.
Can you repeat the first budget amendment again?
Yes, sir. It was $16,361. It was donated money from Greenville Utilities that we got last year, and we had to roll it forward, have it appropriated into this fiscal year so we'd be able to continue to spend it.
Mr. Chairman, I move the approval of the budget
Second
amendment.
that.
that has been presented.
Motion and second, all in favor?
Second.
Aye. Matters carried. Okay, Ms. Quinn, you also have a report regarding the fiscal year 2011 and 12 goals and objectives.
I have the first
Perfect
page
timing.
of it. Yes, sir. It's on the first page that you've got here of the goals. For the first quarter, we had ended up our expenditures at 20%, and if you were looking at a straight line expenditure rate, we would have been at 25%, so we were able to hold our expenditures down by 5%, which I think is pretty good. And the same is true with our revenues. We collected 18.24% of the 20% we spent, and the reason it's a little bit off is because of the timing when the revenues come back into the county. They're months behind. And then I have a goal of visiting daycare centers, and so far in the first quarter we visited 6 daycare centers. We go out to monitor their fiscal operations.
Are you paid for that?
What, to go out?
Yes. Do you get do they pay us or you to go out and to inspect the daycare centers?
We're not actually inspecting the daycare center. We're looking at their financial operations, but the salaries that the people get are reimbursed about 50% overall administrative money.
Is there some way that you can increase the amount of money that you have coming into so that you could use it?
No, sir. No, sir. It's a set pot of money that the state tells us how many dollars we can have for that salary, and it's a set pot, so we couldn't get any more.
It's a part of our quality assurance to make sure that the daycare providers are registering the kids when they come in there. They're assigning the kids and that the paperwork is there, so we go in to monitor that to make sure that everything is correct.
We are constantly making sure that we're maximizing all of the revenues that we have available to us to receive, and we do that through the coding. When all of this Child Protective Services programs, we get several pots of money. They're capped pots, but we make sure that social workers are coding correctly so that we can draw the money down. Every year we get down every bit of the money that's set aside for Pitt County. We stay on top of that.
Can I ask a
Yes,
question
sir.
about the report? Sure, I'm reading it, right? If we're looking at, I'm looking at the administration fiscal division.
Yes, sir.
Yeah.
The top.
Is this correct? From 2008 to 2010, the budget roughly went down 7%. Is that correct? Is that what you're saying there?
Our actual expenditures went down
Okay.
by that much, yes, sir.
And then in 2008, number of providers per year were 22. And then in 2010, 2011, it was 37.
Yes, sir. We just tried to visit more daycares. We're not mandated to visit them at
Okay.
all, but we try to see if we can do more. And so in 2011, my staff member had a goal of trying to do 37 over the year.
So in other words, we got less overall money, but we increased what we were doing by almost 30%. Is that correct? Okay.
I should have said earlier, there's multiple components to this report, so
And
Ms. Quinn and then Ms. Dixon and
Ms.
Mr.
Dixon
Avery.
is not here today, so I'll be
Okay.
going through part of hers for you. I want to turn to page 14, and we're going to look at senior and disabled adults are living in a safe, stable, and least restrictive, suitable environment. A 98% annual percent of adult care facilities whose resident remains safe. We had one that was out of compliance, 1 out of 22, so we were at 98% there. And our CAPS allocated slots, we have 100 slots filled out of 108 slots, so we're trying to maintain all of our slots, so we had 93% filled. And we have spent 1/4 of our allocations for personal care and home management, which is good because we're looking at quarter basis of the funds, so we have spent 1/4 of that. And then of our special assistant in-home slots, these allow people to stay at home as opposed to going to rest homes. We have 16 slots, and we have 13 of those slots that are filled, so we're at 81% as opposed to 77%. So we're trying to get up to 100% in that. So,
Mr. Perry, these numbers that are listed as not applicable, we didn't measure this in previous years.
what we did before, we just put the number of people. We did not break it down into percentages, so we're trying to move to the percentages as opposed to the number to show you how much we're actually doing as opposed to just the number that we did. So you can get a rough idea whether we're at 100%, 90% of what we should be.
And the targets that Dr. Hampton referenced, those are set based on previous years.
Right.
Previous year's actuals
Right.
converted to a percentage.
Right. Any questions?
On page 15, I want to get ahead of
Okay.
where you are. 58% annual percentage of adults at risk of abuse, neglect, exploitation, living independently as a result of case management services.
We have a total of 66 total adults, and we had 31 that were in the facility with enhanced care. So of that total, we had 58% that were living independently and did not need a service. So they were in home as opposed to being in a facility. So that was 58% of our total adults of 66. We had 31 that were in a facility receiving the service.
Against the
Right.
goal of 90%.
90%.
On your indicators, your objectives down there, the Casey Family Program funding,
Yes.
I noticed we were at 14 and we were obviously shooting for 100%, but does that mean 14, we should have been 25% in the first quarter?
It should have been 25%.
25, not 100%,
Right.
okay. That's the long-term goal.
Right.
That if we were approximately 60% of the way there, did that by chance come from staffing and staffing time and ability to be able to do it? Is
We
this a
have-
non-mandated program?
This is a non-mandated program that we have received a grant to do this program. So this is one that we received a grant case from the Annie B. Casey Foundation
Okay,
to do parent partnering. And we have a parent partner here that work with our in-home clients to help them to go through the process of regaining their children. So that's the purpose of that.
all right. Is that, I guess my question in general, Mr. Perry, is that was staffing why we were half of what we should be
No.
or not?
It was just the way that we used the money for that first quarter.
Okay, okay.
And I asked him that question earlier about the one above that we just spoke about, the 58% as well. Are these case management services, how does the discussion we just had around staffing relate to any of the shortfalls we have up?
Yeah.
And to date, you said you didn't think that they were,
No,
there was a correlation between the two.
not in these.
Okay.
Please look on page 16 of your board packet. The first report is the progress made in the Work First Family Assistance Program and Work First Employment Services. Our target for the percentage of families receiving Work First Employment Services is 94%, and for the first quarter, we exceeded that at 98.8%. This means that in terms of numbers of families served, 165 families represents a 98.8% served. The next measurement is the number of Work First recipients finding employment. In the first quarter, we found employment for 10 clients in the Work First Employment Services Program, and I looked ahead to see how we're doing in this quarter, and for October and November, we've already assisted 17 clients in finding employment during those 2 months, and we'll still have to look ahead to December for the second quarter. The final measurement in that program measures the percentage of Work First participants who are no longer enrolled in the program employment retention, and our goal was 80%, and we exceeded that goal at 94.3%. So the 94.3% is represented by 72 clients who remained employed for at least 12 months after finding employment and having left the Work First program. On page 17.
Is that, might I ask, is these goals, that's your annual target? So in the first quarter, we've already exceeded what our target was, is that correct?
Well, we're supposed to maintain that percentage, so we want to at least maintain 80% or better at any given time throughout the year. It's an ongoing tracking of the percentage.
Some of these are cumulative to your earlier point, and some
Right.
of these are.
So we do not want to fall.
Confusing presentation for me. Not yours.
Right, but we don't want to
When it
fall below
changes.
80%.
Okay, so instead of annual target, a better definition of that might be at any point, a year-long
Right,
target.
right.
In other words, a
Right,
continual target.
Right.
Maybe continual target would be a better word.
okay. But that is, we don't want to fall below 80% at any given point in time.
Thank you.
Okay. Under the page 17, the Food and Nutrition Services Program, the state mandates that at least 97% of applications taken are processed within 30 days. And we are at 99.5% for the first quarter. That represents 7,970 applications processed within 30 days. And the reason that figure is so high for the first quarter is we had the Food and Nutrition Services Disaster Program. And in September, we started that program on September 10th, and it ran for 5 days beginning September 10th. So normally, we're on average in about 1,000 applications per month, but all those applications were included in the ones that were completed in September as part of that first quarter. So we exceeded our goal for the first quarter. On page 18, the Medicaid programs. The first category is medical assistance to the disabled. And we receive a report card monthly on this, and our average of the monthly report card for the first quarter for medical assistance to the disabled is 96%. That represents 639 applications for those making that type of application. The state pulls out the applications for medical assistance to the disabled. So we process 96% timely out of 90. Now, when we move to the next category, that's all other Medicaid application programs. And again, the state mandates 90%, and we met it, we exceeded it slightly at 91%. And that total of applications processed for those 3 months is 3,047. That represents 91%. The final category is North Carolina Health Choice Applications, and that's a program that is through the Medicaid category, but is for, the income limits for that program are higher, exceed the normal Medicaid application income limits. So we don't have as many receiving in that category, but we have 141 processed, which represents, that should be 93%. It's a typo, not 95%. So we exceeded it at 93% for the first quarter. 141 applications out of 151 processed during those 3 months. The final page is the child support program. We did not meet our goal of 91%. We got as high as 88% for that category. We have 8,432 actual cases registered for child support, and we have 7,419 cases under order. That means those cases were worked and completed, and there are enforcement actions on 7,419 cases, so that's 88%. When we look at the collections, we're not quite where we need to be on the first quarter. We collected $3,390,736. Our annual target is $13,150,000. And we always expect to do better in collections in January, February, and March, because through child support, we can do collections through income tax intercept. So usually we have higher collections in the third quarter of the fiscal year. So we're expecting to make up what we haven't made in the first or second quarters of this program. I'll be glad to answer any other questions.
Even if you continued on your current path, you'd be over 13 million at the end of the year, right?
Yeah, we should. I'll be happy to answer any other questions you have.
Okay. Thank you to the team. No other questions regarding the report of 2011 and 12 to date. We asked the management team, and I thank you for bringing us those updates of progress. Before we go to the director's report, just to wrap up on some of what we talked about today, the board is concerned a bit with the bandwidth, if you will, of the department in light of projected increasing service needs going forward. At the same time, recognizing we've got to make some budget cuts, so asking the management team to bring back a comparison and risk analysis of those individual programs, particularly beginning with those that are either, by necessity, needs for communities, and then those that are federally mandated. And you've got those in the back, just a kind of your assessment of the risk of that, so that we have some idea of what to do to be an advocate for those programs.
With the prioritization.
Yes, sir. With a prioritization by community need first.
That's right.
Then federal mandated, that kind of thing, so we can walk through that. So, all right, Mr. Perry, your director's report.
Okay, in the director's report, you have our board schedule and the county commissioner schedule. We will have some meetings on Tuesdays and some on Monday, because sometimes the commissioners will be meeting on the same Monday that we meet. So just need to go ahead and put this in your Outlook calendar so you'll have that. But we will try to keep you updated with this. Our next meeting will be on Tuesday, January the 10th. So that our next meeting will be on Tuesday. And this also will be posted on our website for the community to be aware of that. And you also have the list from the county commissioner's schedule as well, so you have that. Also in your packet you have a listing of our mandated programs, optional service. We have very few optional programs that we operate, and the majority of everything that we do within the Pitt County Department of Social Services are mandated services from our Child Protective Services, foster care, adoptions, adult protective services, food and nutritional service, family children Medicaid, child support. So all these programs are mandated services, and we will probably go in more detail with this as we start our budget process looking at that, but this is just to give you an idea of the programs that we operate and the statutes and the federal guidelines that we operate on, and looking at those services that we operate within Pitt County Department of Social Services.
I'm wondering, would this work, Mr. James? What do you think in terms of using these mandated programs here, and then maybe having something about how the frozen positions are affecting these mandated services?
I think that's going to be brought back, what has been requested.
You're gonna bring, that'll be, yeah.
Yeah, that's just on.
Yeah.
No, what I was saying is using this format.
Yeah.
Well, including number of staff in
Right.
that department and then
Yeah.
number of vacancies.
We'll break it out, the different programs, the number of staff that we have, the caseload size that they're currently carrying, how many vacancies that we have in those units. And with those vacancies, that will show you the increase in their caseload, because for each vacancy, whether 400 cases, 500, whatever, that means that someone else have the responsibility of seeing those clients, doing those reviews, acting on those changes. So even if we have 4 or 5 vacancies, they just don't sit there. Someone have to do the maintenance on those cases. So
And again, our concern is just not so much what those vacancies are, but your assessment of whether or not there is a critical mass problem that means we cannot deliver the services. Not that we can't do it well or average or whatever, but that we've reached a point of we, as you said earlier, will fail on the report card. Those categorical listings, and whether that, if you want to use a ratio of caseloads and benchmarks or whatever, I just think that we're going to have to trust your and the management team's assessment of whether or not it's possible or not beyond those.
Because I was thinking one of the things, maybe in one of the last 1 or 2 meetings, where some of the caseworkers got a very large increase, and those increases are going to keep going on.
You know, and I want to make sure we don't put the commissioners or others in a difficult position of having
Sure.
all this information that they simply can't act on because there is a fixed pie of money.
Sure. Yeah.
That has to be. I just think we need to put them in the position of having the knowledge of what is at risk and at jeopardy, not just that.
Yeah.
That we're concerned about it, but that we help them quantify the risk,
Yeah.
because I think that would help them make the decisions, not
Exactly.
necessarily mandate what those decisions need to be.
That's all done under the heading of the word priority, is it not?
Sure.
Prioritization
So,
of those.
any other questions today?
Yeah, just got, you got food and nutrition service participation report. This is a report that goes from January 2005 up until June of 2011. If you look at it in January 2005, we were at 16,634 participants, which was 49.19% of the number of people eligible to receive in Pitt County. June of 2011, we were at 31,765 participants, which from 93.94%. So you can see that we went from 49% up to 93.94%, increase of 15,134 additional people receiving. So you can see what had happened from January 05 up until June 2011. So this will give you an idea. When you look at this, you can look at all the counties and see where they rank and how caseloads, number of participants are increasing. So this is just something to show you what's happening not only in Pitt County, but in the state as a whole as far as food stamp participation.
All right, any other business before we go into closed session? All right, we have a need to go into closed session.
I so move, Mr. Chairman, that we go into closed session.
Okay, I think we have to have you take us into closed session and then entertain a motion to do so.
No, let you do it. What we do, we have to.
North Carolina General Statute 143-318.11 regarding closed sessions, Section A, permitted purposes. It's the policy of this state that closed sessions shall be held only when required to permit a public body to act in the public interest as permitted in this section. A public body may hold a closed session and exclude the public only when a closed session is required. Also, item number 1, to prevent the disclosure of information that is privileged or confidential pursuant to the law of the state or of the United States or not considered a public record within the meaning of Chapter 132 of the general statutes.
All right, I have a motion and a second. All in favor? All right, we're in closed session.
Let me check.